let's understand the blood flow inside the heart. As mentioned, these two are the atrial chambers responsible for collecting blood. Right atrium receives deoxygenated blood from all over the body, that is from the pre-cardiac region, from the post-cardiac region. Left atrium at the same time receives oxygenated blood coming in from the right lung and the left lung. After the atrial chambers are filled with blood, the blood is passed on to the ventricular chamber on the same side. That is, deoxygenated blood from right atrium enters the right ventricle and oxygenated blood from left atrium enters the left ventricle. In the next phase, blood from ventricle is passed on to the respective arterial vessel. That is, deoxygenated blood from right ventricle enters into the pulmonary artery and it takes towards lungs for oxygenation. While oxygenated blood from left ventricle enters the aortic trunk and it is distributed to all over the body. So, collection of blood in the atria is the first phase, passing it on to the ventricle is the second phase, and releasing it into the arterial vessels is the third phase. Let's understand how does that happen. This is the first phase wherein the atrial chambers are receiving blood. Mind well, this time the tricuspid, bicuspid and semilunar, all the valves are closed. So there is no further blood flow in the first phase. Only the atrial chambers are collecting blood from the respective venous vessels. In the second phase, blood from atria is passed on to the ventricular chambers. That is, as you can see, the deoxygenated blood from right atrium has entered the right ventricle. Oxygenated blood from left atrium and has entered the left ventricle. This time the tricuspid and bicuspid valves are open, but the semilunar valves are closed. This is the third phase in which the tricuspid and bicuspid valves are closed, semilunar valves are opened and the blood from ventricles is passed on to the respective arterial vessels. That is, deoxygenated blood from right ventricle has entered the pulmonary artery and it's taken towards lungs for oxygenation. While oxygenated blood from left ventricle has entered the aortic trunk and it will be distributed to all over the body. This is how the blood flow happens inside the heart. The blood flow, as discussed earlier, is regulated within the heart. As we have already discussed, the heart is myogenic, so there is no direct control by the brain or the nervous system. How does it happen within the heart? See, there are two controlling centers. One which is present on the right side of the right atrium. This one is called as sinoatrial node or SA node. It is also called as Keith-Flack node. That's the sinoatrial node. While another one is atrioventricular node or it is node of Tawara. AV node it is also called as. From SA node, certain neuromuscular fibers start. These are called as Purkinje fibers, which will be going around the atrial wall. Whereas from the AV node, a bundle of fibers starts, that's called as bundle of His, which goes through the interventricular septum, then divides into left and right fibers. These are now going to be Purkinje fibers, which distribute throughout the ventricular wall. That is how the distribution of neuromuscular fibers is seen inside the heart. Now let's see how the nodes regulate. SA node is called as a pacemaker, while AV node is called as pace setter, which simply means SA node will initiate the heartbeats, AV node will maintain the heartbeat. In the first phase, when the atrium is collecting blood and receiving blood, this time after the atrial chambers are filled with blood, the SA node is triggered, and this initiates a wave of contraction that goes through the Purkinje fibers and brings about contraction of the atrial chambers. That is called as atrial systole. Atrial systole, during which the blood from each atrium is passed on to the respective ventricle. Now, AV node on its own does not initiate an impulse. Instead, it gets triggered by a nearby Purkinje fiber that has originated from SA node. And once it is triggered, now that stimulus will pass on through the Hayes fibers, through the interventricular chamber, and once it has reached the apex, now it will bring about contraction of the ventricular chambers. That means now it will initiate ventricular systole. During ventricular systole, the blood from ventricles will be passed on to the arterial vessels. That is, from right ventricle into pulmonary artery, from left ventricle into aorta. After all the contents of ventricles are released into the respective arteries, now the atrial chamber has started undergoing relaxation. Relaxation starts spontaneously. It doesn't require a trigger. So relaxation starts inside the atria and continues into the ventricles. That is, the phase wherein atria start relaxing followed by ventricles. This is called as common cardiac diastole. Remember, diastolic phase is not distinguished as atrial diastole and ventricular diastole. It starts in the atria and concludes in the ventricles, and hence it's called as common cardiac diastole. It brings about relaxation of the entire heart. Common cardiac diastole, which begins in the atria and concludes in the ventricle. That means the two nodes on their own will maintain the heart rate. Yet there is an extension of a vagus nerve from brain that extends up to both the nodes. This nerve is seen to be responsible for changing the rate of heartbeats. But these two nodes will take care of the contraction relaxation of the respective chambers. Atrial contraction, that is atrial systole, needs a span of about 0.1 second. Ventricular systole or ventricular contraction requires a span of 0.3 seconds, whereas common cardiac diastole, which is described as the longest phase in the cardiac cycle, requires 0.4 seconds. So the entire heartbeat, the entire cardiac cycle is completed in a span of 0.8 seconds. And that's how in 1 minute there are about 70 to 72 beats which are completed inside the heart. That is, 72 beats a minute is a normal heart rate.